Hi there, my name is Stacy and I'm a nursing student from Georgia Southern. I'm going to provide privacy and wash my hands. Can you go ahead and tell me your name and date of birth?
Emily 1001.
Okay, all right, Miss Spencer. So what I'm going to be doing today is I'm going to just be doing an assessment of your body systems. Can you tell me your first name?
Emily,
Okay, can you tell me where we are right now?
the nursing building.
And can you tell me what day of the week it is?
Tuesday.
All right, patient is alert and oriented ×3. She is awake. Are you in any pain right now?
No.
And are you comfortable?
Yes.
Okay, I'm going to make sure that the bed is locked. The bed is all the way in the lowest position. I will normally put my 2 side rails up and I'm going to clean my stethoscope and make sure that my patient's call light is right there next to her. Okay, my patient is articulating well. Her speech is appropriate. She's responding intelligently to my questions, which tells me that she can hear well. The cranial nerve associated with hearing is going to be the vestibulocochlear nerve. I'm going to evaluate and inspect her external eyes. So her eyes are equal distance from her nose. They are equal distance from the midline. Her pupils are black and they are equal. Her eyelids are not outturned or upturned, and her eyelashes are upturned. And I see no cresting. Okay. I'm going to now assess for perla. We're testing to see the oculomotor nerve, the trochlear nerve, and the abducens nerve. So I would have my pen light, and I would ask you to just go ahead and look straight up at the ceiling. Okay, and we are testing to see if the pupils are going to expand or constrict. All right, go ahead and look at my finger, and look at this finger. Okay, pupils accommodate appropriately, so her pupils are equal, round, reactive to light, and accommodate. Okay. And then I'm going to just assess for facial symmetry. All of her features are equal distance from the midline, and the cranial nerves associated with the face are the trigeminal nerve and the facial nerve. So I'm just going to inspect her skin. I'm looking at the skin on her arms. It is congruent with her ethnicity. I see no lesions, no variations in color. I don't see any vascularities or bruising. And I'm just going to inspect her pressure points. So I'm going to look behind the elbows. I'm going to look on the C7. I'm going to look on the back of the heels. Those are just a couple examples. I see no pressure sores. I'm going to palpate for your extremity pulses. So I'm going to palpate the brachial pulses. They are bilateral equal +2, regular rate, regular rhythm. I'm going to palpate her radial pulses. Bilateral equal, regular rate, regular rhythm +2. I'm going to do her her posterior tibial pulses. Bilateral equal +2, regular rate, regular rhythm. And then you'll do the dorsalis pedis pulses +2, regular rate, regular rhythm, and bilateral equal. I'm going to inspect for edema. I don't see any edema, but you would grade it if you see it. I'm going to want to check cap refill in both her toes and in her fingers. Her capillary refill is less than 3 seconds, which is appropriate. My patient's body posture is laying down in the bed right now. She is laying straight. Can you go ahead and wiggle your toes for me? Okay, can you move your knees up? Okay, put them back down. And can you put your arms above your head? And then back down. Okay, my patient's range of motion is appropriate for her age and it is symmetrical. Do you have any numbness or tingling in your extremities?
No.
Okay, no numbness and no tingling. So I'm just going to assess her respirations. I see that she doesn't have any extra effort with her respirations. Her depth is appropriate. I'm not seeing any use of accessory muscles. That is the sternocleidomastoid and the trapezius muscles. And her positioning, she is just laying supine. Her chest shape is, her AP to T ratio is 1:2, and she is not barrel chested. So I'm going to go ahead and listen to her lateral surfaces of her thorax. I'm listening for the different breath sounds. Okay, if you can go ahead and sit up for me. So your breath sounds were all clear. I'm listening to 2 points on the lateral surface, 1, 2, and then 4 points on the posterior surface. You're going to want to differentiate the different breath sounds. She had the bronchial sounds over the larynx and the trachea, the bronchovesicular over the bronchioles, and she had vesicular sounds over the peripheral lung fields. I did not hear any adventitious sounds, but the other adventitious sounds are crackles, rails, wheezes, rhonchi, and pleural rub. I'm going to do my cardiovascular assessment now. I'm going to want to listen to my patient and make sure that she has S1 and S2 sounds and not S3 and S4. I'm going to make sure she doesn't have any murmurs, and I'm going to make sure that S1 is loudest at the apex and S2 is loudest at the base. I'm going to start on this side. You'll come around here. I'm going to start on this side, and I'm going to listen at the second intercostal space. Okay, so both of these are on the second intercostal space. You're going to come down here, and then that was the fourth, and then this one's going to be the fifth intercostal space. Okay, so I heard S1 and S2. I did not hear S3 and S4. I heard no murmurs. S1 was loudest at the apex and S2 is loudest at the base. I've identified the rate and the rhythm. It is regular rate and regular rhythm. And now I'm going to do an abdominal exam. So I'm going to stand on the right side of the bed to first inspect my patient's abdomen. So I'm inspecting the abdomen. It is normal in contour. The skin is even. I don't see any discolorations, dry scars, anything of the sort. No hernias. Can you bear down for me? Okay, no hernias and no abdominal distension. I'm going to listen for bowel sounds, starting in the right lower quadrant over the ileocecal valve. Listening for 3 spots in each place.
I'm sure they're loud right now.
Mm-hmm. Okay, my patient had bowel sounds present in all 4 quadrants. Now you are going to want to warm up your hands, and you're going to palpate for tenderness, and you are going to note if you see any guarding or rigidity. Are you having any pain when I palpate?
No.
Okay. And I don't see her doing any guarding or, and I don't feel her muscles tensing up, which is the rigidity. So I'm just going to do my final safety check. I'm going to make sure that my bed is locked and lowered, that my side rails are up, and that her call light is right there next to her. Do you have any questions for me?
No.
All right.